Welcome to the deep dive. Today, we're taking a close look at something quite common, actually. Staphylococcal infections, or, just staph in our dogs and cats.
Yeah, something many pet owners will unfortunately encounter at some point.
Exactly. And we've gathered a bunch of resources, guides, expert articles, all focused on staph in pets to really sort of dig into it.
And the plan is to really unpack what these sources are telling us, give you a clear picture of what staph infections actually are, why they happen so often, how vets figure them out and treat them.
And crucially, this whole issue of antibiotic resistance, what that means, and, what practical things you can do.
Right. Protecting your pet and your family, too.
Okay, so let's jump right in. Basics first. When we talk about staph infection in pets, what are we actually dealing with? What is this bacteria?
So staph, it's a type of bacteria. The sources describe them as gram-positive, and they're spherical, like tiny little balls. Kochi is the technical term.
Puche.
And under a microscope, they often look like like a bunch of grapes clustered together. It's quite distinctive. And some types can produce toxins, too, which adds to the problems.
A bunch of grapes. Okay, I can picture that. And where do they hang out? Are they just floating around everywhere?
They are, yes. They're ubiquitous is the word the sources use.
Yeah.
They're found all over the environment. But, and this is really key, they're also very common inhabitants, commensals, living quite normally on the skin and the nose, mouth, even the gut of lots of healthy dogs and cats.
Okay, wait. So they're supposed to be there sometimes?
Often, yes.
Yeah.
They're part of the normal micro-community on our pets.
So this is where it gets interesting then. If they're normal, how do they suddenly flip the switch and cause, a nasty infection?
That's the million-dollar question, isn't it? The sources call them opportunistic pathogens.
Opportunistic.
Yeah. Think of them as just waiting. They only cause trouble when something disrupts the pet's natural defenses. So maybe a break in the skin barrier, that's the big one, or if the immune system is weakened somehow. When those defenses drop, the staph that was already there, just hanging out, can suddenly overgrow and invade tissues, and that's when you get an infection.
So it's not usually a new germ invading from outside, but the ones already present taking advantage. That makes more sense.
Precisely.
Now, when people hear staph, many think MRSA, right? The human superbug. Is that what's usually bothering our pets?
That's a really common question, and the sources are clear on this. While Staphylococcus aureus, that's the MRSA one, is the big player in humans, the most common species causing problems in our dogs and cats is actually a different one. Staphylococcus Pseudintermedius.
Pseudo-intermedius. Okay.
Yeah. You might sometimes see S. schleiferi or S. hyacus mentioned too, but S. pseudointermedius is really the main one vets encounter in pets.
Got it. So related, but a different main species. And you said they're opportunistic, needing some kind of weakness. What typically causes that weakness? What opens the door?
This leads to probably the single most important point from all the sources. Staph infections in pets are almost always secondary.
Secondary. Meaning?
Meaning they happen because something else is already wrong. The staph infection is the obvious problem you see, but it's usually just a symptom of an underlying issue that messed up the skin or the immune system first.
Okay, so finding that underlying issue is critical then. What kinds of things are we talking about? What are the common culprits?
Well, the sources list quite a few, but one stands out massively, especially for those skin infections, the pyoderma, that keep coming back. And that's allergies.
Allergies, right, like itchy dogs.
Exactly. Allergies cause inflammation, they damage that crucial skin barrier, plus they make the pet incredibly itchy. All that scratching, licking, chewing.
Creates little openings in the skin.
Precisely. Perfect little entry points for the staph that's already living there. We're talking flea allergies, food allergies, environmental ones like pollen, dust mites, you name it.
Wow. So the allergy hits the skin, and the pet's reaction makes it even worse for bacteria to get in. No wonder managing allergies is such a big deal. What else?
Endocrine disorders are definitely high on the list, too. Things like hypothyroidism, Cushing's disease, even diabetes. These conditions can directly affect skin health and weaken the immune response.
Makes sense. Hormones impact everything.
They really do. Then you've got echoparasites, fleas, obviously, but also mites like Demodex or Sarcoptes. They irritate and damage the skin, much like allergies do.
Right. Anything breaking that surface layer.
Exactly. And immunosuppression is another big one. Maybe the pet is on long-term steroids for another condition or undergoing chemotherapy.
Or has a disease that suppresses immunity itself.
Right, like FeLV or FIV in cats or certain cancers. And of course, any simple trauma or wound, a cut, a scrape that's a direct physical break.
That's the obvious one, yeah.
Then there are things like poor grooming. Matted fur can trap moisture and debris right against the skin, creating a perfect environment, or just staying damp too often.
And what about breed differences? You see some breeds with lots of skin folds.
Yes, conformation, as they call it. Breeds like bulldogs, pugs, sharpies, those folds trap moisture and heat, making them prone to infections.
So their very anatomy can be a risk factor.
It can, and sometimes it's other underlying skin diseases causing problems. And finally, something that might seem counterintuitive,
Hmm.
prior antibiotic use.
Really? How does that contribute?
Well, especially broad-spectrum antibiotics given repeatedly, they can disrupt the normal, healthy bacteria on the skin and gut. This can kind of clear the way for staph to overgrow, and importantly, it can select for resistant strains.
Wow. Okay, so the treatment itself can sometimes set the stage later on. So putting this all together, what's the big takeaway for owners seeing these infections?
It means that just throwing antibiotics at the staph infection, while often needed short-term, is usually just papering over the cracks. If you don't find and manage that underlying cause, the allergy, the hormone imbalance, the parasites, whatever it is, that staph infection is very, very likely to just keep coming back.
That really shifts the focus, doesn't it? It's not just about the bacteria, it's about why the bacteria got a foothold.
Exactly. The real battle is often against that predisposing factor.
Okay, so staph needs that invitation. Once it's in, where does it typically cause problems? Skin is the big one you mentioned.
Yeah, skin infections or pyoderma, that's definitely the most common manifestation. And it can range from superficial, just affecting the top layers and hair follicles, to deep, which is much more serious.
Let's start superficial. What does that look like, typically?
So superficial pyoderma, often called bacterial folliculitis, is super common in dogs, maybe a bit less in cats. You'll see signs like little red bumps, papules, or maybe small pimples with pustules, often right around the hairs.
Okay.
You might also see these funny circular lesions, kind of crusty or flaky at the edges. Those are called epidermal collarettes, basically where pustule popped and healed imperfectly. Generally, there's scaling, crusting, redness, and often some hair loss, sometimes little tufts that pull out easily.
Yeah, I think many people would recognize that, maybe on their dog's belly or chest. What about the deep kind? You said that's more serious.
It is. Deep pyoderma often starts superficial but gets worse. It goes down into the deeper layers of the skin, even the tissue underneath. It's much more painful.
Ouch. What are the signs there?
You'd see more significant swelling. The area would be tender to touch. Sometimes there are draining tracts, oozing pus, or even blood. Hair loss is usually more severe and widespread. Common spots are places like elbows, hocks, the chin, and especially between the toes or on the feet, pododermatitis.
That sounds nasty. Okay, so skin is number one. Where else does staph tend to pop up?
The ears are another huge one. Otitis externa or media outer or middle ear infections. Staph is a very common culprit there.
And the signs for that?
Oh, redness inside the ear flap, discharge, could be waxy, could be pus-like, definitely a bad odor usually. And the pet will be shaking their head, scratching at the ear, clearly uncomfortable.
Right. And elsewhere?
It can cause urinary tract infections or UTIs. So signs like having to pee more often, straining or showing pain when urinating, maybe seeing blood in the urine.
Okay.
And as we mentioned, any wound or abscess is a potential site. Staph loves a break in the skin. Less commonly, you might see it cause respiratory infections, bone infections, osteomyelitis, or even spread through the bloodstream causing sepsis. But those are much rarer than skin and ear issues.
Okay. So if a pet owner sees these kind of signs, the skin issues, the ear trouble, UTI symptoms, and they take their pet to the vet, how does the vet confirm its staph and decide on the best approach?
It's usually a combination of things. It starts, naturally, with a good history, finding out when it started, what's been tried, and a really thorough physical exam, looking closely at the skin, ears, everywhere.
And then tests?
Yes. For skin problems, often the first step is cytology. It's a quick test, usually done right there in the clinic. The vet takes a sample, maybe pressing a microscope slide onto the affected skin, or swabbing a pustule or getting some ear discharge.
And looks at it under the microscope.
Exactly. They're looking for inflammatory cells, usually neutrophils, the infection-fighting white blood cells, and, crucially, for bacteria, especially those little round cocci, often in those grape-like clusters we talked about.
Ah, the grapes again.
Yeah. And seeing bacteria actually inside the inflammatory cells is a really strong indicator of active infection. Cytology can also pick up other things, like yeast, which often complicates things. So it confirms bacteria are involved and helps the vet make an initial educated guess about which antibiotic might work. That's what we call empirical therapy.
So cytology gives a strong clue, confirms bacteria, but it doesn't tell you exactly which antibiotic is best, especially if it's resistant.
Precisely. And that's where the sources really hammer home the importance of the next level. Bacterial culture and sensitivity testing, or CNS.
A gold standard, you say?
Absolutely. The
Yeah.
sources call it the gold standard for choosing the right antibiotic. And with resistance being such a growing issue, it's becoming more and more vital.
When is it absolutely necessary to do a CNS?
Well, the guidelines say it's crucial if the infection is chronic, keeps coming back, if it's a deep infection, or if the pet hasn't responded to the first antibiotic tried. And it's considered mandatory if you suspect a resistant infection, like MRS. You simply cannot tell if it's resistant just by looking.
Makes sense. How does it work?
The vet takes a sterile sample, maybe from an intact pustule or deep draining tract, and sends it to a lab. The lab grows the bacteria, identifies exactly what species it is, like S. Pseudintermedius, and then tests a panel of different antibiotics against it to see which ones actually kill it or stop it from growing.
So it gives you a roadmap.
Exactly. It tells you what will work and what won't. This is the only way to reliably detect methicillin-resistant staph, MRS, and know which drugs, if any, are still effective. The sources mention needing a good sample and sometimes a washout period off antibiotics first, though that's not always possible and necessary.
Okay, so CNS is key for targeted treatment, especially for tricky cases. Any other quick tests often done?
Yeah, often they'll do things like skin scrapings or tape preps right away too, looking under the microscope for mites or yeast, because those are common underlying or concurrent problems. And then, of course, once the immediate infection is getting under control, there's the whole investigation into the underlying cause. Allergy testing, hormone tests, whatever is needed.
Right, back to finding that root cause. Okay, so we've got the diagnosis, maybe even the CNS results. How do we actually treat these things? What's the plan?
The sources lay out two main goals running in parallel. One, get the current infection under control, and two, manage whatever underlying issue allowed it to happen in the first place.
Okay, controlling the infection, does that always mean pills?
Not necessarily. In fact, the sources really emphasize topical therapy things applied directly to the skin as a cornerstone of management. Shampoos, sprays, mousses, wipes, ointments.
Why are topicals so important?
Well, for starters, in mild or localized cases, they might be enough on their own. But even in more severe, widespread, or deep infections, they're considered absolutely vital support. And here's a really interesting point. Topicals often work against both regular staph and the methicillin-resistant strains.
Oh, really? How come?
Because you're putting a very high concentration of the active ingredient, right where the bacteria are living, on the skin surface. It can often overcome resistance mechanisms that systemic drugs might struggle with at achievable body concentrations.
That's fascinating. What kind of ingredients are in these topicals?
Common antiseptics include chlorhexidine, that's in loads of medicated shampoos, sprays, wipes. The sources stress for shampoos, you need that contact time lathering up and leaving it on for maybe 10 minutes before rinsing. Really let it work.
10 minutes. Okay, good tip.
Yeah. Benzoyl peroxide is another one, good for flushing out follicles. Hypochlorous acid is newer but effective. Then you have topical antibiotics like mupirocin, often used for small spots, maybe around the nose or something. Or fusidic acid, gentamicin in creams.
And how often do these need to be used? Sounds like a commitment.
It often is, especially at the start. Medicated shampoos might be needed 2-3 times a week. Sprays, wipes, mousses might be daily or even twice daily. Following the vet's instructions on frequency is really key for them to work.
Okay, so topicals are huge, but sometimes you do need systemic antibiotics, the pills or injections.
Oh, absolutely. For infections that are widespread, deep, really severe, or just not getting better with topicals alone, then systemic antibiotics are necessary.
And how does the vet choose which one?
If it's a straightforward, first-time superficial infection and cytology confirms bacteria, they might start with an empirical choice. That means picking an antibiotic that's usually effective against staph and pets based on experience and general patterns. Common examples listed are things like cephalosporin, ceflexin is a very common one, or amoxicillin clavulinate, clindamycin, maybe trimethoprim sulfa.
But if it's more complicated, or if that first choice doesn't work,
Then it's back to that culture and sensitivity. If empirical treatment fails, or if it's a recurrent or deep infection, or especially if MRS is suspected or confirmed, the choice must be culture-guided. You use exactly what the CNS report says the bacteria is sensitive to.
and the options might be more limited then.
They can be, especially for resistant strains. But the lab report tells you what those options are, maybe doxycycline, minocycline, chloramphenicol, for example. The sources specifically advise against using certain classes like fluoroquinolones empirically due to resistance concerns and strongly warn against using critical human drugs like vancomycin in pets. We need to protect those.
Right. Antibiotic stewardship. Very important. Now, what about how long the antibiotics are given? People often think a week, maybe 10 days, but you hinted it's longer.
Much longer, usually. This is a point the sources really drive home. It's often way longer than owners anticipate. For a superficial skin infection, the minimum course is typically 3 to 4 weeks. And crucially, treatment should continue for at least 7 days after the skin looks completely normal again.
A full week after it looks clear. Wow.
Yes. And for deep pyoderma, it's even longer. Minimum 6 to 8 weeks, sometimes more, and continuing for at least 14 to 21 days, that's 2 to 3 weeks after everything looks resolved clinically.
That is a serious commitment for the owner.
It really is. But stopping too soon, even if the pet looks better, is a major reason for treatment failure, recurrence, and development of resistance. Finishing the entire course is non-negotiable. The sources also specifically mention that pulse therapy, giving antibiotics on and off to prevent recurrence, is generally not recommended anymore as it breeds resistance. Intermittent topical therapy is preferred for prevention.
And all this time, we still have to remember the other pillar.
Managing that underlying disease, yes. You can give antibiotics perfectly, use all the topicals, but if you don't get the allergies or the thyroid condition or whatever it is under control,
It'll just come back.
almost inevitably. The sources are unanimous on that.
Mm.
Addressing the root cause is absolutely fundamental for long-term success.
And sometimes supportive care is needed too, right? Like we're itching or pain.
Definitely. Medications to control itching or pain can make the pet much more comfortable during treatment, though vets are cautious, for example, with steroids for itch if there's an active infection, as they can sometimes hinder the immune response.
Okay. Now let's talk more about this methicillin-resistant Staphylococcus MRS. You mentioned it's an emerging problem. How big a deal is it?
It's definitely a significant and growing challenge in veterinary medicine, and these MRS strains are often multi-drug resistant, MDR, meaning they're resistant to not just methicillin-like drugs, but often several other antibiotic classes too.
And remind us, which MRS are we mainly seeing in pets?
The main one, according to the sources, is MRSP. That's Methicillin-resistant Staphylococcus Pseudintermedius, the resistant version of the common pet staph.
Right.
We can also see MRSA, the human one, which pets can carry, sometimes get infected with. And MRSS Methicillin-resistant Staphylococcus schleiferi is another one popping up more.
And how do they become resistant? What's the mechanism?
It's usually because they acquire a specific gene called the MECI gene. This gene essentially changes the target site for a whole class of important antibiotics called beta-lactams. This includes penicillins, cephalosporins, moxiclav, basically many of our first-line drugs. The drugs just can't bind effectively anymore.
Which is why CNS is so vital.
Absolutely vital, because you cannot tell it's resistant just by looking. An MRSP infection can look identical to a regular staph infection. Diagnosis relies solely on that culture and sensitivity test.
So if a pet is diagnosed with MRS and many common antibiotics are off the table, what's the treatment strategy?
This is where aggressive topical therapy becomes even more critical. The sources describe it as the absolute cornerstone of management for MRS.
Even more so than for regular staph.
Yes, because systemic options are limited. That high concentration of antiseptic or topical antibiotic delivered right to the skin can often overcome the resistance, especially for superficial MRS infections. Many times, intense topical therapy alone might be sufficient if it's just on the surface.
That's encouraging. What about systemic drugs for MRS?
They're used only if necessary for deep or very widespread infections where topicals aren't enough and their selection must be strictly based on the CNS results. You use one of the few drugs the lab report shows it's still sensitive to.
Is an MRS infection inherently more aggressive or deadly than a regular one?
That's a good question. The sources suggest that the prognosis for recovery from MRS is actually comparable to non-resistant staph if, and this is the big if the underlying cause is managed and appropriate therapy is used. It's harder to treat because the drug choices are limited, but the bacteria itself isn't necessarily causing a more severe disease process, assuming you can find something that works against it.
Okay, that's somewhat reassuring. It highlights the treatment challenge, though. Now, what about us, the owners? Can we catch this from our pets, especially the resistant kinds? The zoonotic risk.
It's a valid concern, and yes, there is a potential risk. The sources confirm that staph, particularly resistant strains like MRSP and MRSA, can pass between pets and people due to our close contact.
How does it usually spread?
Mainly through direct contact. Touching the infected skin or wound on the pet, then maybe touching your own face or breaking your skin before washing your hands. Contaminated surfaces, bedding, toys, bowls can play a role too.
Is the risk level the same for MRSP and MRSA?
Slightly different dynamic. MRSP is mostly an animal bug. Transmission to humans happens, but it seems relatively uncommon, and when it does, it usually causes fairly minor skin issues in healthy people. MRSA is primarily a human bug. Pets often get colonized temporarily from people in the household. While pets can transmit MRSA back to human-to-human spread is still the main route for MRSA. But the sources do highlight that certain people are at higher risk if exposed. Anyone with a weakened immune system, young kids, elderly folks, people on chemo, transplant patients, those with conditions like HIV or uncontrolled diabetes, they're more susceptible to any infection, including these.
So, given that risk, what are the practical steps owners should take, especially if their pet has an active infection, maybe even confirmed MRSA?
Good old-fashioned hygiene is incredibly powerful. The sources stress this repeatedly. Hand hygiene is paramount. Wash your hands thoroughly with soap and water or use an alcohol-based sanitizer frequently, especially after touching the pet, their bedding, bowls, anything they've contacted while infected. That's number one.
Makes sense. What else?
If there are open sores or draining areas, try to keep them covered with bandages. Wear disposable gloves when you're cleaning wounds or changing those bandages. And during the active infection, it's probably wise to limit very close contact. Maybe no face licking, reduce prolonged cuddling, maybe no co-sleeping, particularly if there are high-risk people in the house.
And cleaning the pet's environment.
Yes. Regular cleaning of bedding, washing it in hot water if possible, clean food and water bowls daily, ideally not in the kitchen sink where you prepare human food. Wipe down surfaces the pet frequently touches.
What about contact with other animals or people outside the home?
During an active infection, especially MRS, it's best to limit contact. Avoid dog parks, groomers, daycare. Keep infected cats indoors. And definitely inform any high-risk individuals who might interact with the pet so they can take extra precautions. One more important note from the sources. Routine screening of healthy pets just to see if they carry MRS is not recommended. And trying to eliminate carriage in a healthy pet with antibiotics is generally ineffective and just promotes more resistance. Focus hygiene efforts during active infections.
That's really clear, practical advice. Okay, so wrapping things up, overall, what's the prognosis for a pet with a staph infection? Can they typically be cured?
Yes. Generally, the prognosis is described as good. Most pets, even with recurrent issues or MRS, can be managed successfully.
And the keys to that success, what makes the difference between getting it under control and constantly battling it?
It really boils down to those core themes we've hit on. Number one, without a doubt, identifying and effectively managing the underlying cause. That's paramount. Number two, using the appropriate treatment, the right combination of topicals, maybe systemic drugs guided by CNS if needed, and crucially, for the correct duration. No stopping early.
Right, that long duration.
And number three, good owner compliance. Following through with the whole plan, the shampoos, the pills, the follow-up visits, managing the underlying issue. It takes teamwork. If those underlying problems aren't addressed, or if preventative strategies like maybe ongoing topical therapy aren't kept up for susceptible pets, then recurrence is unfortunately quite likely.
This has been incredibly thorough. We've gone from the great clusters under the microscope to the absolute necessity of CNS testing for resistance, the power of topical therapy, and this relentless focus on the underlying trigger. It really paints a full picture.
It does. Understanding that chain reaction, the underlying problem, weakening defenses, allowing the opportunistic staph to invade, that's really the core concept.
So thinking about the big picture here, we know staph bacteria are basically everywhere on and around our pets. And we know infections can flare up pretty easily if the skin barrier or immune system is compromised by common things like allergies or thyroid issues. What does this deep dive really tell us about the sort of profound importance of just overall wellness and proactive care? Does it suggest that maybe the best defense against these complicated staph problems is actually preventing or managing those underlying conditions right from the start, keeping our pets as healthy and resilient as possible overall?
That's a really insightful way to frame it. I mean, yes, it absolutely underscores that focusing on the root cause isn't just about clearing the current infection. It's fundamentally about building and maintaining the pet's overall health baseline to prevent future problems.
Yeah.
Proactive wellness is key.
Fantastic. Well, thank you for joining us for this deep dive.